What's up? Doc Mike. Today's topic for July 29, 2020, the detailed roadmap, Part 1, Bblc. Box, or contain, and break, or neutralize, the liabilities of COVID-19 at the barangay level. Original concept of CAPMI's reverse HAMLET COVID-19 program at the barangay. The crucial key to delay, control, and stop the rapid spread of COVID-19 infections in the Philippines. Question: where do we start doing what needs to be done versus COVID-19? Answer: in the barangay, with everyone living there actively participating in the program. Background: pacification, or compliance by introducing prosperity at the barangay. In the early 1950s during the Indo-China War, the French proposed a new concept of a protected village to fight insurgency. This is based on a solid and very effective concept, pacification by prosperity. In the early 1960s, the government of Vietnam introduced the strategic HAMLET program to pacify insurgency in South Vietnam. The goals of this strategic HAMLET program were focused on security, economic development, social advancement, and political participation. It was designed to separate, physically and politically, the Viet Cong guerrillas and their supporters from the rural population. They build barriers in each strategic hamlet to defend it, enforce curfews, check identity cards, and search out hardcore communists and many other activities. The strategic hamlet program eventually failed because the peasants, who had been identified as the focus in the war against the insurgents, rejected the program because the promised reforms did not materialize amid the corruption and bureaucratic inefficiency related with the implementation of the program. Present-day Philippines, moving to the present times, COVID-19 pandemic is a greater enemy that attacks us in an almost invisible mode. It seemingly is an unbeatable foe, but there is a weak point on which this adversity can be beaten, plain and simple, the vector of transmission. The virus will not survive nor spread if there is no human body host to transmit it after another, and generally for our academic discussions today, it is the Filipino vector. The diagram shows the cycle, from COVID-19 virus, to Filipino vector, to violation of minimum health standards, resulting to rapid spread of COVID-19 infections, which then results to overwhelmed or overheating Philippine healthcare system, and sadly, resulting to thousands of preventable Filipino deaths nationwide. While we all wait for that elusive vaccine, the best way to win the Philippine war versus COVID-19 is for everybody to strictly adhere to the mandatory minimum health standards our government wants every Filipino to do. And from where do we begin and make our final stand in the Filipino all-out war versus COVID-19? Let's choose and declare that the Filipino all-out war versus COVID-19 will be fought at the barangay level, focused and controlled, so that everyone in the barangay can participate, contribute and be accountable in the final outcome of the program. How? Reverse HAMLET program at the barangay. This involves health, economic, psychosocial, mental, and even spiritual re-engineering at the barangay. Methods: elicit compliance to minimum health standards by introducing sustainable multi-sector participated prosperity-based programs at the barangay. 1. Effect bandwagon compliance to minimum health standards imposed by our government at the barangay level. Residents of barangay must be empowered, persuaded, to self-regulate to fight COVID-19 based on carrot and stick, rewards and punishments principle. 2. Actions must come from within the barangay, not forced from outside. 3. Involve everybody living inside a barangay to participate and contribute to the project. 4. Project must be inclusive, comprehensive, holistic, involving public-private engagements between the government and private sector. 5. Project must be sustained 24/7 and result-bound. 6. Nationally monitored, supervised DILG Office of Barangay Affairs, but locally implemented Barangay Health Emergency Response Team. 7. Laterally supported by national and local government agencies. 8. Simultaneously supported by private sector. 9. Training, seminars, livelihood activities, cottage industries. 10. Online, digital support and technology-driven infrastructures. 11. Creation of a cyber HAMLET counterpart. This is the difference between the Vietnam War-type HAMLET and reverse-modified HAMLET. In the first model, there are village relocation, uproot and transfer of people. Outsiders are prime movers. There are use of intimidation, use of force, shame and violence. The enemies, communism, discord, and underdevelopment. It is unpopular and a failure. And corruption is present. On the other hand, the second model, no relocation, instead resources poured into from outside. Barangay residents are the prime movers. It is conscience-driven, voluntary, consensus, effective, peaceful, and prosperity-driven. Enemies are COVID-19, discord, and poverty. It is popular and participatory. There will be no corruption due to private sector watchdogs. Mental exercise, a common or motherhood remark nowadays goes, people should stay at home so we can stop the rapid spread of COVID infection. Our statement, people must work from home and not just stay at home doing nothing. If government wants people to stay at home, government must give them a good reason, aside from staying alive, to do so. Example, identify the benefits people will gain, safety, personal development, livelihood, entertainment, etc., to make them comply with minimum health standards. To be continued on Part 2 of the CAPMI's Barangay Reverse HAMLET program.